Okay, so yeah, welcome everyone. It's so great to be here with you all in this virtual meeting space. I'm so delighted to kick off our 2025 guest talk series with Dr. Kim Harley. And before we introduce Kim a little bit further, I just want to say a quick few words about our new guest talk series that we're launching this year and a few just kind of general housekeeping items. And then I'll pass it over to Claire, who is our new healthcare and programs coordinator, and will be helping to host and moderate this guest talk with Kim Harley today. This is a great new year for Climate Farm School. We are continuing to offer our courses at our host farms all over the US and Europe, and are kind of bringing in an additional focus and lens around agriculture, planetary, and human health. And really wanting to kind of leverage those intersections of human health that start with the soil and agricultural practices and ripple through to the people who grow our food, the people who eat food grown on farmland all over the world, and really look at those intersections and hopefully welcome a bunch more healthcare professionals, physicians, nurses, dietitians, nutritionists to our courses into the future in both kind of our diverse cohorts of adult professionals and maybe in the future also some dedicated courses for healthcare professionals to really explore those intersections and bring that into their education, research, training. So we're kicking off the series today. We'll probably aim for like monthly guest talks throughout the year. And we'll be looking at, various intersections of climate, agriculture, soil health, human health. And today we're very lucky to hear from Dr. Kim Harley. So I'll pass it over to Claire to introduce Kim a little bit further. And since we're expecting kind of smaller groups for a lot of these guest talks, feel free to keep your cameras on if you're able to and put questions in the chat throughout. Claire and I can moderate that, and we'll have a more generally open time for Q&A towards the end. But if there's a clarifying question in the middle, you can just raise your hand. We'll welcome people to come off mute and ask their questions at the end. But yeah, please engage throughout and keep track. We'll use the chat to keep track of our questions. Cool. Over to you, Claire.
All right. Thank you, Lainey, for the wonderful introduction. And thank you everyone here today to hear Kim talk to us about environmental exposures and farm worker health. So Dr. Kim Harley is a professor of public health and associate director of the Center for Environmental Research and Community Health at UC Berkeley. She's a reproductive epidemiologist whose research focuses on how chemicals in our homes and in the environment influence women's reproductive health and the health of their children. For much of her career, she's conducted community-engaged research with farm worker families in California's Salinas Valley through the CHAMACOS study. Dr. Harley has published extensively on environmental chemical influences on fertility, birth outcomes, neurodevelopment, respiratory health, and timing of puberty. She's also engaged youth from farm worker communities in conducting research and advocacy to address environmental justice issues. So Kim has obviously done some amazing work in this realm, and I know I'm excited to hear what she has to say. So with that, I'll pass it over to you, Kim.
Great, thank you. And I'm gonna see if I can get my slides to work. Okay, you can see my slides, right? So great, thank you for having me. It's great to be here. And as Claire said, I'm going to be talking basically about the project that we've been doing in the Salinas Valley for the last 25 years, looking at farm worker family health. I have no conflicts of interest to declare. So as I'm sure everybody on this call knows, California is the leading agricultural state in the nation, and we produce about half of the fruits, nuts, and vegetables that are grown in the US. We also use more than 200 million pounds of pesticides per year. And what you can see on the map on the left is a map of pesticide use. This is actually organophosphate pesticide use in California, and it sort of highlights where the agricultural areas are. It's a sort of a nice way to see where the most intensive growing is happening. California is really unique in that we have to, all pesticide use has to be registered with the state. And so we have really rich data about which pesticides are being used, how much they're being used, and where they're being used down to the square mile level of detail. So our study area is the Salinas Valley, which you can see right there. And it's a small valley, but as you can see from all of the red on the map, it's an area of really intense pesticide use and intense agriculture. Our study area goes from Castroville in the north to King City in the south. It's about 100 miles down the valley, and it's about 100 miles south of where our research center is located at UC Berkeley. If you've never been to the Salinas Valley, this is what it looks like. We call it the salad bowl of America. It's where lots of salad crops, cole crops, broccoli, and then a ton of strawberries are also grown there, and other berries. So this is also what Salinas Valley looks like, and this is another image of what Salinas Valley looks like. So our research center is called the Center for the Health Assessment of Mothers and Children of Salinas, but nobody calls it that. We call it CHAMACOS. And CHAMACOS means kids in Mexican Spanish, and that really reflects the study population that we work with. We are a university community partnership, and we've been in the Salinas Valley since 1998 is when we got funded, so for a long time. And the objectives, excuse me, of our study are to estimate sources, pathways, and levels of pesticide exposure to mothers and children living in an agricultural community, to determine the relationship of these pesticide exposures with maternal and child health, and then to find ways that we can reduce exposure to children to pesticides through interventions in community research or community outreach. And I just want to say that all of our research has always been couched in the idea and the tenets of community-based participatory research. It's been very important to us since the beginning that we be a community-based project. And so these are some of the commandments that we sort of set for ourselves when we started back in the late 90s. You can see things like to give back to the community more than we take, to be culturally sensitive and appropriate, to employ and train community members, those kind of things, to share, and a really important one is to share study results with the community in a timely manner. So we're interested and are interested in children's health. And one of the reasons that we are is that children are both more exposed and more vulnerable to toxicants. They're more exposed because they crawl around on the ground. They are doing all sorts of hand-to-mouth behaviors, picking stuff up, getting dirt and dust from the ground into their mouths. They have a less varied diet. And when you think of the small size of a child compared to the size of an adult, they just eat and they drink and they breathe more as a proportion of their body size. And then they're more vulnerable because their metabolic pathways are less developed, so they're not as able to clear these toxicants from their bodies as adults are. And they're developmentally immature. So this is a big thing because we're really worried about toxic insults to developing organs. So when we're talking about developing brain and other organs, this is where it can be a critical time period of exposure for later health effects. So what we did is in 1999 to 2000, we recruited 601 pregnant women from prenatal care clinics in the Salinas Valley. And we have seen them 15 times since birth. We've just finished our young adult visit when they were 21 to 23 years of age. So we saw these little, sorry?
The little lamb.
Yeah.
It's little, sorry.
To say hi, so I thought I'd return the
Thank you.
greeting.
Thank you.
Oh.
I'm ignoring you right now.
Somebody's not talking to me, right? Okay. Sorry, it's really, if anybody does have questions, please just speak up because it's really hard for me to see raised hands or anything with the slides up. So I'm happy to take questions. So as I was saying, we've seen them 15 times since they were born. During pregnancy, we were in the hospital after delivery to interview the moms, and then you can see multiple time points as they've been growing up. Our population is really representative of the farm worker community. They were mostly our moms were mostly Spanish speaking. They were mostly born in Mexico. And in the time when we enrolled them during pregnancy, about half of them had only been in the United States for less than 5 years. So pretty recent immigrants, fairly low education level. Most were living in poverty. Not all of our moms worked in agriculture. About 44% of them did, but most of them had farm workers living in the home. And I should mention that the enrollment criteria wasn't that they'd be ag workers themselves. It was just that they were low-income women who were receiving prenatal care at the prenatal clinics throughout the Salinas, a network of prenatal clinics throughout the Salinas Valley that served the farm worker population, and they had to speak English or Spanish. And then over the years, we've done multiple developmental assessments. So each time we saw the moms and the kids, we would do an interview with the moms, and then we did about a 2-hour health checkup on the kids, which included mainly neurodevelopmental testing. We've done functional brain imaging. We did lung function through spirometry. We did all sorts of anthropometric height, weight, body fat measurements. And then between the ages of 9 and 13, we did a puberty assessment. And in addition to assessing the children, we are interested in looking at their pesticide exposure. And one of the ways that we did this is we collected multiple biological samples. So we've got urine, blood, and breast milk on the moms. We've also got saliva and hair and teeth on the kids. We were like the tooth fairy. So when they were in kindergarten and they lose a tooth, they could send it to us and we would send them back a little gift card. And we've also measured house dust to figure out what's actually in the dust in people's homes. And we have more than 400,000 samples stored in our lab, representing 25 years of data collection. The other way that we can measure how people are exposed to pesticides is related to the pesticide use reporting data that I mentioned that is really unique to California. And because this data exists, we can map out, if you look at this map over here on the left, the dots represent where the homes of our participants, and then we can map out exactly how much different pesticides was used in certain time periods around their home. And then we can use geospatial analysis to calculate the total number of pounds of different pesticides that were applied around their home during pregnancy, during early childhood, in the first trimester of pregnancy, things like that. And so it really gives us two different ways of looking at pesticide exposure. We can look at what's actually in their bodies through these biological samples, and then we can look at what's exposed, what's been applied around their homes. And these are they're both good ways of measuring exposure, and they both have drawbacks. Obviously, what's being applied around your home, that doesn't capture what you might be exposed to at school or at work, or if you're working in the fields. So this is one measure. When we are measuring things in urine, it's a different measure of internal dose, but it's a rather short-term biomarker of exposure, so it's a little bit harder to get long-term exposure that way. So we use these two different ways to kind of triangulate two different methods of looking at exposures. The pesticide exposures of interest, organophosphates are what we started with. We actually were originally funded in 1998 to look at organophosphate pesticides, but in the years since, we've looked at pyrethroids, we've looked at the manganese-containing fungicides, fumigants, and more recently, we've looked at glyphosate. And here's just a graph or a visual of agricultural pesticide use in Monterey County over the last almost 25 years that we've been there. And you can see when we started, organophosphate pesticides were the most used. They've decreased considerably since then, but they're still definitely OP use in Salinas. So as I mentioned, our initial focus was on the organophosphates. These are, if people are not familiar with these are insecticides. They represent about 35% of the insecticides that are used. They used to be available for use in home pesticides, like your spray can for pests in your home, but that was banned in 2001 because of concerns on children's health, but they're still used in agriculture. The way they work is they affect the nervous system of insects, but they do the same thing in mammals. They depress acetylcholinesterase, which kind of cleans up the synaptic gap when the neurons are firing, so they just overexcite the central nervous system until it sort of shuts down. And we know that if you're poisoned, if a human has acute exposure to organophosphates, they end up in the emergency room and it can result in death. What we were interested in when we started this is, at the time, we didn't have any idea what the effects of ongoing chronic low dose exposure to organophosphates were. We knew about the acute effects of organophosphate poisoning, but we had no idea, and there was really no data on what the effects were of low dose ongoing exposure to the fetus's brain or to children's brains. So that's the primary thing that we were looking at. And one of the things that had happened in the late 90s is that the lab tests had finally been developed to measure metabolites of organophosphates in urine. So for the first time, we were able to actually measure the internal dose. The metabolites are called dialkyl phosphates, or DAPs, but that's not really important. It's just the metabolites that we excrete after we metabolize organophosphates that have gotten into our body. So we looked for those metabolites in urine, and we found pesticide residues of organophosphates in all of the pregnant women in our study. And those levels were higher than levels in the general US. By the way, most of us have levels of these in our bodies through food that we eat or some other source. We also found pesticides in 97% of the breast milk samples that we measured from our lactating moms, and in nearly all the house dust samples that were collected. So really very, very widespread exposure in the homes and the bodies of moms in this community. And what we wanted to know is, are these exposures related to children's brain development and children's health? This is one of the IQ tests that we were doing on children. I think this is probably about a 5-year-old. We did over multiple years. So one of the first things we found is that the metabolites in urine of these organophosphate pesticides are associated with reduced IQ in children at age 7. So we did neurodevelopmental tests on them when they were very young, but by the time they're in school at age 7, we can do a proper IQ test like they would do in an educational setting. And to orient you to this graph, we have no controls in our study. What we have is a population of moms, some of who all live in this agricultural community, but they have varying levels of pesticides in their bodies. So we have people with high levels, we have people with low levels. And when we compare the moms whose levels during pregnancy were low, you can see the average IQ is 107 compared to about 100 among the children of the moms with high levels in their bodies. So what we're seeing is a 7-point decrease in IQ, comparing those with high levels of OPs in their bodies compared to those with low levels. And to put this in context for you, 7 points is about the decrease in IQ that you would see for a child that has high levels of lead exposure. So this is something that we're very concerned about. It also, another way of thinking about 7 IQ points is it's about 6 months of development. So it's saying that the kids are acting sort of as if they were 6 months younger in terms of their development. And this analysis controlled for a bunch of factors like the amount of stimulation in the home, the maternal IQ, maternal education, language assessment. We also were looking at, we did some scales to test for attention problems in ADHD. And to orient you to this graph, it's for each 10-fold increase in the levels of organophosphates in the mom's urine. We see about a 7-point increase in attention problems on our scale, and about a 1.3 increase in ADHD type behaviors. So associations with these higher prenatal exposure to organophosphates with ADHD and attention problems at age 5. And then when we looked similarly at a scale for autism spectrum traits, we see that moms with higher levels now our line is below 0. We're seeing decreased social skills at age 7, according to either the parents' report or the teacher's report. The lines, by the way, are confidence intervals. So if they don't cross 0, that means they're statistically significant. And we also see with higher maternal organophosphate levels, increased autism spectrum traits at age 14. So we have a fairly small population. We don't have kids with overt autism, but we're looking at autism spectrum and looking at behaviors that are typical of or representative of autism spectrum. And then when their kids were 15 years old, we actually did we did fMRIs sorry, we did f-meters, which is a portable way of doing brain scanning and looking at brain activation while they were doing tests of executive function. And what we saw is that moms with higher levels of organophosphate pesticides in their bodies during pregnancy, we saw decreased brain activation in certain regions of the brain of those kids while they were doing executive functioning tasks. So what we're seeing here is multiple different indications of changes in neurodevelopment, basically among children whose moms have higher exposure to these pesticides that we know are neurotoxic type of pesticide. We also were interested in organophosphates and respiratory symptoms because we know that acute exposure to organophosphates is associated with respiratory distress and in field workers. When we looked at our kids, what we saw is that, higher levels of the organophosphates in the moms during pregnancy, the prenatal exposure was associated with about a 1.7 times increase in the odds of having respiratory asthma-like symptoms. And in the kids between ages 0 and 5, we saw about a 2.5-fold increase in risk of experiencing these asthma-like respiratory symptoms. So a stronger impact even than in the prenatal exposure we saw was with the early life exposure in the kids. And overall, I mean, we have a large research group. There are many people involved in all of this research, and we have multiple papers published on this. But overall, looking at organophosphate pesticides in mothers during pregnancy, we saw that that was associated with shorter pregnancies, so shorter gestational duration, abnormal reflexes in their newborns, poor verbal abilities when they were in preschool, problems with attention and lower IQ, as I mentioned, when they were in school age, more respiratory symptoms and poor lung function in school age, traits similar to autism that we saw at age 2 and at age 7, and at age 14 rather, and then decreased brain activation at age 15. So this is, as I said, 20, 25 years of evidence that's built up looking at organophosphate pesticides and what they are associated with among people that are exposed to them through living in a farm worker community. On the plus side, the use of organophosphates has really, really decreased since the late 90s in California. And what you may have heard the news or seen in the news the last several years, chlorpyrifos was banned in California. So chlorpyrifos is one of the organophosphate pesticides. I will say that there are a lot of organophosphate pesticides that are used. They all work in a very similar way. Chlorpyrifos, for some reason, is the one that's gotten a lot of attention. It was banned in California. It was not banned nationally. There's been a lot of lawsuits back and forth, and it depends on which administration is in power. And so I don't know what's going to be happening moving forward, but I will tell you that chlorpyrifos cannot be used in California, and who knows what will happen with the rest of the country. But I will also say there's lots of other organophosphates that are still being used. And as I said, we started with the organophosphates. I should mention too, there are hundreds of pesticides that are used in California. So it is really hard to, one of the things that's difficult about doing this research is keeping up with all of the different pesticides and thinking about how they actually are used, if sometimes used in combination, sometimes used on nearby fields. And so we're exposed to multiple pesticides at the same time, especially if we're living or working in agriculture. But we've looked at some of this is now, instead of looking at what's in urine, there's only a few pesticides that we can actually measure in urine. So when we want to look at other pesticides, we often look instead at this residential proximity to the use of pesticides. So we can look at multiple different classes when we look at where somebody's house is. So you can see here, this is a change in the full-scale IQ. So we're seeing a decrease in full-scale IQ with the OPs. But we also see that the manganese fungicides and the pyrethroids and the neonicotinoids, when moms live near applications of these other types of pesticides, we also see about a 2-point decrease in IQ. So just to say that we went to Salinas to look at the organophosphates because we knew they were neurotoxic, but some of these other classes of pesticides that we know less about, we are also seeing links to IQ and brain development in children who live close to these areas, or specifically with their moms live there close to these applications during pregnancy. We see a stronger association. The strongest association we see is the exposure to the moms during pregnancy. We don't see as much for brain development with the kids in childhood. It really seems to be the most important time period is what the mom is being exposed to while she's pregnant. We also, I don't think fumigants were on that slide I just showed you, but when we look at chlorpicrin, methyl bromide, I don't believe it's used anymore, but we also see associations with decreased IQ. In this case, the postnatal exposure as well as the prenatal exposure. So to show you again the agricultural pesticide use in Monterey County, the trends over time, I want to talk now about this one down here, which is increasing, and that is glyphosate. So recently, we've been very interested in glyphosate and what the health effects on families and children would be. Glyphosate is the active ingredient in Roundup. It's the most commonly used broad spectrum herbicide in the world, and we've seen its use increase dramatically in the last 2 decades in the United States. It's used to control grass and weeds in a whole bunch of applications in agriculture, forestry, rights of way, parks, yards, golf courses, that kind of thing. In our food, we're all exposed to glyphosate through our food, and it's primarily found in grains and legumes, oatmeal, oats, that kind of thing. In California agriculture, it's used in almonds, walnuts, oranges, that kind of orchard. It's used in wine grapes, excuse me, in cotton and alfalfa. And one of the things that's helpful for us doing research on pesticides is like the organophosphates, we can measure it in urine because it's eliminated in urine as its parent compound and as a metabolite. So we can have a biomarker of internal exposure. And here you can see in Monterey County, our squares are getting darker red, and we can see that use has definitely been increasing of glyphosate use recently. Most of the conversation about glyphosate has been about cancer, and it's been pretty controversial. The WHO has declared glyphosate to be a probable carcinogen to humans, but the US EPA has said that it's not. The European Chemicals Agency just did a big review, and they decided that it's not. So they've said that glyphosate can continue to be used in the EU for the next 10 years, but there was a lot of protests during this time of the re-registration and a lot of concern about potential cancer effects of glyphosate. We actually were looking at something a little bit different. There had been a study coming out saying that glyphosate might be associated with liver problems, and we were contacted by a doctor in the Salinas Valley saying that he's seen incredible amounts of cases of fatty liver disease in young children, which is a group that you wouldn't expect to be having that outcome. And so we worked with him to look at glyphosate and liver function and metabolic syndrome in our CHAMACOS kids. And what we found is that a higher level of glyphosate metabolites, so in the bodies of children, measured now at when the kids were age 5, age 14, and age 18, was associated with higher glucose, higher triglycerides, higher blood pressure, and these things together, including increased waist circumference, are indicators of metabolic syndrome, which puts people at increased risk of diabetes and heart disease. And we also saw increased odds of poor liver function. So this is fairly new research and something that really, I think, deserves a little bit more attention. We also, by the way, are interested in, we've submitted a grant. We're hoping that in the future we'll be able to look at glyphosate exposure to pregnant women and how that may impact their birth outcomes and infant health. We'll see what happens with that one if that gets funded. So I just do want to point out that obviously health and development are determined by a whole bunch of factors, from our genetics to our host factors, Our immediate environment includes pesticides, but it includes a whole bunch of other social factors. And then there's the larger environment that these children and these families are living in. Here's some things that just to show you some of the adversities that the people, the families in our cohort experience. We see more than a third of our population of farm workers who are picking our food are experiencing food insecurity and on food stamps. Most of our population is living below poverty. We see fairly high levels of maternal depression when the kids were younger. Biological dad is not in the house, possibly because he's traveling for farm work. And really poor housing quality. We have lots of moves, rodents in the home, and stressful life events in these children when they were younger. When they were 18, we assessed their adverse childhood events or experiences. So these are potentially traumatic events that happen in childhood that we know are really associated with later health outcomes in life. And what we see that of our mothers, 50% of them have experienced at least one adverse childhood event, and 26% have experienced 3 or more. And among our young adults, the CHAMACOS kids, if you will, when they now report about their childhood looking back, 59% have at least one ACE, and 28% have 3 or more. So we're looking at a population. And by the way, the examples of ACEs include things like physical, emotional, or sexual abuse, physical or emotional neglect, violence in the home or community, incarcerated parent, that kind of thing. So we're seeing high levels of adverse events in these communities and in these people. Back in 2016, following the first Trump election, we started asking our participants, both the children and the moms, but here I think is when the children when they were 16, asked about their fear of deportation. And keep in mind, all of these children were born in the United States, right? All of these kids were born in the hospital in Salinas and been in our study since they were born. We can see that 25% of them worry about family separation due to deportation. This was 8 years ago. I imagine people are having the same worries now. So high levels of fear about deportation. And when we were concerned that that was going to have effects on their health, I'm not talking about pesticides anymore. Now I'm just sort of talking about the psychosocial situations that farm workers live in. And what we see is higher concern about, with children who were reporting higher concern about their fear of deportation. We see a statistically significant increase in anxiety of the youth, as reported by the youth and the mom. And we also see poorer sleep quality. And when we looked at the mothers, we actually see that their concerns, their worry about deportation, moms with higher worries about deportation had poorer cardiovascular health, including greater BMI, greater risk of obesity, larger waist circumference, and higher pulse pressure. So we're actually seeing that this fear seems to be increasing or impacting people's health. And then from an environmental justice point of view, we want to know, what happens when pesticides and social stressors are combined? And, it's really not good. What we're seeing is that, or what we're expecting is that the combination of an environmental exposure plus reduced resiliency because of the stress or adversities experienced in life can lead to even worse outcomes than those things, each one of those individually. And one of the ways that we looked at this is, I showed you that organophosphates, pesticides were associated with reduced IQ in children. But when we divide our group into children with low family adversity, that prenatal exposure to organophosphates leads to is associated with a 2.5 point decrease in lower IQ that's not statistically significant. But when we look at children with high family adversity, we see that it's associated with an 8.2 decrease in verbal IQ, and that is statistically significant. So it just feels like if you're exposed to organophosphates prenatally and you're living in a family with high adversity, the impacts on brain development just seems worse than among those families where there's no adversity or there's other family resiliencies. This is just a slide from the recent UC Merced study of farm worker health. But just to show you, this isn't our population, this is just sort of representative of farm workers in California. But we're seeing a whole bunch of health concerns. We see 15% are saying that smoke, wildfire smoke, or other environmental smoke interfered with breathing while they were working. We see 67% with a high fear of separation due to deportation or otherwise. 80% with low or very low food security, 36% saying their health is not good, fair or poor, 87% in this study showing they have at least one ACE. We see obesity, we see diabetes or prediabetes, and then to top it all off, we see about half of them have no health insurance. So, you know, we've studied the effects, the actual environmental health effects of pesticide exposure to farm workers, but I just want to make sure we understand that this is also in this context of really poor health across the board and lack of resources for health insurance and for healthcare. So our ultimate goal is to reduce families' exposure to pesticides and other toxicants by acting on the individual, community, and policy level. And one of the things I mentioned early on, we're a community-based participatory research, so community involvement is really important to us. We are governed by a community advisory board that includes people from the farm worker side and from the grower side and from the ag commissioner's office and that kind of thing. And it's also very important to us to make sure that our participants understand what our findings are. So you can see a picture on the left there of one of our community meetings where we were reporting our findings back to our participants and their families. We also have done several studies or projects with local youth in the Salinas Valley to get them engaged in public health research. You can see our youth council there. We do feel that educating farm workers and farm worker families is really important. A lot of farm workers, this is a study we did several years ago, but they're supposed to be receiving worker protection standards training, and 42% reported that they weren't receiving them. Perhaps they were, they didn't understand them or whatever, but 42% said they weren't getting the training. 52% didn't know when pesticides were applied. Most of them didn't know the names of the pesticides, but a majority of them were worried that pesticides could hurt their family's health. Oops. Strangely, I seem to have deleted a bunch of my slides. Not quite sure what to do. I think I'm going to leave it there or see if I can pull them up, but I have just a couple more slides to talk to you about just what we can do to what we can tell people.
Why
don't I just leave it there for questions for 1 second and see if I can find those?
I don't know if it's helpful, but I think on the slides that you sent me, I just realized that there might be some after the thank you slide.
Yeah, no, I think I've got it right here. Don't worry.
Gotcha. Does anyone have?
I got it. I got it.
Okay.
But yes, please, if there's any questions in the meantime.
I have a question. First, just thank you so much for sharing all of this, and it's just an amazing amount of information that you have throughout this study. One question I have to one of your last maybe 3 slides. I'm curious how the community has responded as you've shared findings with them.
Yeah, totally. You know, those meetings are really hard, especially early on when we were, you know, that obviously that meeting where we said, by the way, we've found out that those of you that have higher levels of pesticides in your body during pregnancy, that's associated with poor brain development in your children. And we had to tell them that before we told the press, you know, before we told the ag commissioner, before we published that. And those meetings are really hard. And you know, one of the things that we made really sure to do is that when we told them that, we also spent a lot of time talking about what can you do, right? Like, how can you reduce your exposure and how can you improve brain development in your children? So like there's things like if you read to your child, and if you can't read, if you sing to your child, because not being able to read is actually a reality for a lot of our parents. what are the things that you can do to create a more enriched environment that are within your reach for your child? So yeah, that's really hard. One of the things that was interesting to me is when we did the youth council, one of the youth councils that we did, so some of our youth council work, or all of our youth council work, we recruited a handful of kids from the local high schools, and they came and they would meet with us twice a month, every 2 weeks, to learn about environmental health and environmental justice in their community, and to help us design a study and conduct a study. And at a certain point, the ages lined up that when we were recruiting for our youth council, the CHAMACOS kids were the right age to be part of the youth council. And so we had many of the kids in our youth council were actually CHAMACOS participants. And I remember the day that the very first day, I gave them an orientation and I told them what about our study. I said, I know you've been in this study since you were born, and I'm curious to know what your experience is with it. And I wanted to tell you some of the things that we found. And so I told them, a lot of the stuff that I've just told you, and I was really nervous. And, showing them about brain development, for example. And I said, when I stopped, I said, how does this make you feel to hear this? Because I was worried. And one of them said, it makes me feel so proud. It makes me feel so proud that I have contributed to this knowledge and that I can help other people in our community. And the other ones, people started nodding and agreeing, and I thought, thank God, because I've just explained, you are research participants, and I'm explaining what's been happening in your life. So that was a relief. But I think there is, there's real concern. There's a lot of our participants say one of the things about being in our study is that they've really learned how to reduce their pesticide exposure, and that they've learned a lot more about pesticides, and so that's been a positive. But yes, it's always it's hard. Am I sharing a screen right now? No. Okay. Let me see if I can. Okay, now I'm sharing a screen, right? Great, thank you. So just to tell you some of the things that we've done, we have taught children with puppet shows, different community events. As I mentioned before, our community meetings where we return our results. We send out a newsletter to just keep people on top of what we're doing. I mentioned our peer-to-peer research study, our youth research studies. So this was one called the Cosecha study. This is one of the ones that we had some CHAMACOS participants involved in, and we did a study to research teenage girls' exposure to pesticides in the community, and our youth council were involved in the study design. We trained them and we hired them as summer research assistants to actually collect the data, where they interviewed the girls. They gave them these wristband monitors that measure exposure to a bunch of different chemicals, including pesticides. Our youth collected the house dust samples and they collected urine samples, and they were also really involved in disseminating the results of our research. They made a radio novella that was played. It's like a soap opera about a woman named Maria who's always doing things that get her exposed to pesticides, and so that was played on the radio stations that the farm workers listened to in the fields. They were interviewed on the news in Spanish and English, which was great, so their parents could really understand what they were doing since they were interviewed in Spanish. And some of the things that we found in terms of exposure among the teenage girls, things that you might expect, there were higher levels of pesticides in the bracelets of girls that were living in homes where crops were with crops within 100 meters, where pesticides had been used in the home, where there was an exterminator. But what our youth really zeroed in on was these things that were positive. So we found really significantly lower levels of pesticides among girls who had a doormat outside their home and whose home was cleaned daily. So these were things that they decided, since I let the youth really drive the community outreach part of things, these were some things they wanted to focus on. And one of the messages they really liked was the idea of using doormats to reduce the amount of pesticides you're tracking into the home. So I bought 1,000 custom printed doormats. I said, you guys better be able to hand these out because we have 1,000 of them. And they did, and they went to health fairs, and they really tried to get that message out there. And we've also contributed to local, state, national, and international chemical policy, just because we have these peer-reviewed papers that are out there that can be used to help make policy. So thank you for bearing with me while I lost the slides, but I'm finally at the end here. And what we found is that children living in agricultural communities are disproportionately exposed to pesticides, that this exposure is associated with harms to children's brain development and to lung health, and possibly now with glyphosate looking at metabolic and liver health. That children exposed to additional life stressors may be particularly susceptible. I didn't mention, but we also know that there are some people that are genetically more susceptible, and really that protecting children in farm worker communities is critical. And then just in terms of what we can tell people and about how they can reduce their pesticide exposure, some examples of some of the lessons that we've talked to them about. If you live in an agricultural community, don't wear your work clothes in your home or your car, particularly, take your clothes off before you enter your home, change your work clothes and shower before you're picking up your children. Removing your shoes at the door seems to make a big difference. Having a doormat helps. Removing your shoes at the door is even better. And then washing your floors and surfaces and children's toys frequently. And then if you have pest problems, as an alternative to spraying pesticides, we really recommend keeping food and garbage in tightly sealed containers, keeping counters clean, sealing entry points and cracks, and choosing traps and gels over sprays are things that we can tell people. But really, at the end of the day, this is all putting it on an individual responsibility. This is what you can do. And I think we really need to think more generally about the systemic problems of living in a community where pesticides are being sprayed around your home, or working in fields where pesticides are being used that people have very little control over. And so that's why it's really important to work at the policy level. Just want to point out that there's a huge group of people that work on this study. And I wanted to say thank you.
Thank you so much, Kim. That was, incredibly informative, and I really appreciate the attention on the both kind of like what you can do now, which I also feel like kids can really latch onto and want to respond to, but also the need for systemic change and policy change. And we can take some more questions either in the chat or please raise your hand. And I actually just have a follow-up question about the Youth Council. Just from your experience, Kim, would love to hear more about what questions some of those youth are interested in, if they're like able to initiate other sort of studies and research questions within their communities, and kind of relatedly, if I don't know if the youth are directly coming from families with farm workers in the home or family, and kind of how they see agriculture as a future career pathway, if they think that they're going to want to get involved in agriculture and do things differently, or if they want kind of nothing to do with it based on the studies that you're uncovering in the community. Yeah,
that's really interesting. So we actually have stopped doing the Youth Council now. Our funding just recently ended a few years ago, but we did 9 years, 3 different cohorts of youth. Almost all of them came from families where there were farm workers. Many of them worked in agriculture. In fact, one of the reasons that there's so many reasons why we did the Youth Council work, but one of the reasons is that there's very little opportunity for youth in, for summer employment. Like a lot of people were going to work in the fields, or maybe work in fast food or whatever. So we were offering a research internship basically over the summer where they could learn public health research skills, like learn about environmental health and public health, but also like actually learn the research skills and learn the advocacy. So the way we would do it is the first summer we would do the research project, the actual research. The second summer we would really talk about what we found in the analysis, and the second and third summer was the advocacy summers, where they would come up with, what do you want to do about it? This is what we learned. How do you want to disseminate this information? So we ended up with the telenovela. We ended up with a mural that's display in Salinas of farm workers sort of celebrating agricultural work, but also kind of these are the pesticides exposures and how you want to, I don't know if I had a picture of it. Anyway, your question was, how did they feel about agricultural work? What was interesting was, I think that you kind of, in terms of career, what's around you, what you see. And it was really exciting to show these youth that there was, that research is, and scientific research is a field. And I had students saying to me like, wow, I never thought science was interesting. Like, I never thought science was something that actually was applicable to, to my life or to my family's life. And we ended up, a bunch of those youth council kids ended up in college, many of them in UCs, studying things like environmental health or studying law. Or in medicine. We actually have a bunch of them who've I have a couple that are in public health, and I have one that's a nurse practitioner now. So I think it's really important to open up other fields, to give people the exposure. We took them to Sacramento. We did, in terms of what they're interested in, the first one we did was about chemicals and makeup, because we part of the youth council is that we teach them about environmental health and how that might impact kids their age. And so we, this is probably 10 years ago, looked at endocrine disruptors in makeup and took a few of them to Sacramento to talk to lawmakers about what we found in terms of chemicals in girls' bodies because of the makeup they use. We did a study on cleaning supplies because a lot of their moms work as house cleaners, or and even if they don't work as house cleaners, a lot of people clean their house a lot. So what are the chemicals in those products that they're being exposed to?
Okay.
Any other questions?
I don't have a fully formed question, but just an observation. This was an amazing presentation. Thank you so much. I'd love to hear that the kids are so interested in getting into science once they understand how it affects them. And I guess one of it's so heartbreaking to hear about the brain development and whatnot. And just wondering if there's any movement toward helping children understand about neuroplasticity. And, I realize this isn't the field, but it's just something you try to think of solutions. It's like, okay, this happened to you, but now how do you affect it growing forward? And then especially, in the college system, and I know at Stanford, they do a lot of research on neuroplasticity, but has there been any sort of movement toward helping the children understand that there might be some ways that they can actually improve this thing that has happened to their family and to themselves? So
yeah, I think that's really the message that we try to give them when we do talk about brain development. It's hard to our community presentations are in Spanish, obviously, so people can understand them. But I find the audience, there's a few people that are vocal and they come up and ask questions and stuff, but a lot of the audience sort of sits there and you go, I hope, I wonder what you're thinking. Like, I wish I knew what you were thinking, and that I could, give you the right information or answer the questions that you have. But yeah, that neuroplasticity, I think is so key. We have to look for all of the positive things that they can do, because we really don't want to leave people with this happened.
And you're screwed. Yeah. Yeah. Okay. That's I think that would be a fascinating sort of facet of this, is like, okay, here's, until we can clear this up, you take what's happened to you and then
I really like that framing. I like that framing.
Yeah.
As I say, a lot of the moms, I don't have many conversations with them at all. Our staff down in Salinas is all bilingual, bicultural from the community, and they're the face of the study. We have some participants that are really excited and energized and want to become advocates. And the ones that we do hear from, a lot of them are saying things like, oh, I've learned so much, and I tell people about pesticides, and I tell people what I've learned. And so in that way, it's funny because we're a study, right? We're not an intervention. We're just a study, and we have tried to be clear, like, we're just researchers. We're not healthcare providers, but I do feel like there's a lot of ways in which after 25 years, these participants have a really strong relationship with a lot of our study staff, and they don't necessarily have other people to talk to. And so it becomes, it's sort of an important.
I would think it would be very almost impossible not to become an advocate at that point when you said, see what's happening.
Well, we thought about that very early on when we started. We said, we're scientists. We're not supposed to intervene. We're supposed to be scientists, and we're just observing. And it became so immediately clear from the very beginning that we weren't going to do that. Like, we can't. We're involved, and we're studying your pesticide exposure, and we are also at the same time going to tell you how to reduce your pesticide exposure. We're not going to try to be some like, don't intervene on your own research. No, we need to educate this community as we study this community.
Right. Wow. Such valuable work. Thank you so much.
Thank you.
Really enlightening.
I'm curious if there's, if there's time, and feel free to jump in if everyone else has questions, but if what the conversation is like, or if there is any conversation about like an agricultural system or agriculture without pesticides, or if that just seems like really far off. And I know the reductions are important, but what does it look like to grow food even in like gardens or schools without pesticides, and if that enters into the conversation in your study at all?
Some on a more individual level, and just sort of in the conversations we have people that work in organics, and they're so proud that they work in organics, that they're really happy to tell us that they're working in organics. But there's also, it's so complicated, and people, it's their livelihood, and the most important thing in a lot of ways is that they just keep their jobs, right? So I remember, gosh, what was it? Was it methyl bromide was banned or something in California? And when I saw that, I thought, oh, that's great news. And that they're not going to be using that in California anymore. And I happened to be in a conversation with our field office staff, and they said, oh, everybody's really worried. Everybody's very upset that it's been banned. And I said, wait, why? They said, because all the growers are saying they're going to take their strawberries to Mexico. And I thought, oh, that was so simplistic of me to think banning this pesticide is going to solve all the problems, because from their point of view, it's just creating all sorts of other problems. So it's really, really hard. It was part of the sustainable pesticide, sustainable pest management working group for the state of California over the last couple of years. And that's kind of what I feel like needs to be the way that we're going, is that on sort of the state level, we've made this commitment to be looking forward how we're going to move the needle a little bit into using more sustainable, less toxic for humans and for the environment pesticides as a state. Like, what does it take to just kind of move us here? And it's so challenging and so complex that I feel like that's the direction we need to go.
Yeah, absolutely.
So I know we're running a little low on time, so if anybody has any questions, feel free to chime in. But we did have one from the chat that says, would it be possible to share the list of papers cited for the figures throughout the presentation?
Yes, totally. What's the easiest way for me to do that? I can send an email to you, Claire.
Yeah, that'd be great. And then I can forward it on to you, Nat.
Yeah.
Anybody else?
I can just give all the full citations.
That'd be perfect. Yeah. If you want to send me an email, then I'll follow up with that. And then out of personal curiosity, I know that you mentioned a little bit about following Kristen's question about neuroplasticity and like healthcare interventions. Has your research led to any sort of intervention on how like healthcare providers in the area navigate people who have been exposed to pesticides?
Oh, that's interesting. I don't know about that. I can't speak to that exactly, but I will say that our research has really, we do a lot of work with, in terms of grand rounds and educating the medical providers in our area. And one of the things that this has really led to is an awareness about disability leave. What we have now is a lot of the OBGYN providers in Salinas are now aware that farm workers are eligible, pregnant farm working women are eligible for disability during pregnancy so that they don't have to work in the fields. And so that's been a movement that we've seen, not all providers, of course, but there's certainly a small group of providers who've really been kind of increasing awareness about that as a way to reduce exposure during pregnancy to our to our pregnant farm workers.
Thank you so much.
Thank you. It's a pleasure to talk to everybody.
Awesome. Well, we can close things out for here. We'll send this recording to everyone who registered. And yeah, huge thank you to you, Kim, for your work and for sharing it with us today. And look forward to inviting you all back as we continue this series of conversations. And yeah, it just feels really helpful to share this perspective. And yeah, we're super grateful to you, Kim.
You're welcome. It's great to meet all of you.
Take care, everyone. Have a great rest of your days.